Hi everyone, welcome back. So today, it's been a while, I'm going to talk about a very specific nerve as a treat. So that nerve is called the vagus nerve. Now to give you guys more context in this video, let's go over some rules. So the body will always protect the nerves over your muscle joint system. And so your nerve helps your muscle to move and your muscles help your joints to move. So they work in this orchestrated sequence. And so your nerve is very important because without your nerves, you can't move, and without your nerves, you can't function and live. So obviously the CEO, the master the brain itself, without the brain, you can't do much. So there's a hierarchy, and that's the most important. Now, mechanically, if the region, so it's saying it's motion is lotion. So if the region is not moving well, so it starts at one structure sometimes, and if that structure doesn't allow the region to move, to allow this lubrication, nutrition exchange, so then the whole neighborhood, instead of a house, that one structure, the whole region becomes dysfunctional, and it all impacts each other, so it feeds off each other. So what does this mean? So if you have a nerve that is dysfunctional, it impacts the joint. So the joint either moves too much or it just stiffens up. So either you get a recurrent kink in the neck, or you have a back spasm that keeps happening, or because it impacts your heart lung, it causes this nervousness, anxiousness, or because it impacts your gut, you might get more butterfly in the stomach. And then there's a lot of symptoms that this nerve can impact, because it also impacts your throat, your larynx, your pharynx, so your speaking ability, your swallowing ability, and it also branches towards your ear, so it can give you false sensation of ear fullness. So it impacts a lot. So going back to the rule, that nerve has high importance, right? And then so that nerve is going to be key, and what we find is that teasing that nerve out can help you to move, and that movement, when we do it like a joint manipulation, something specifically targeted precisely at a muscle joint, it stays, it doesn't come back. So we're not having to do that over and over. Early in my career, it's like, okay, let's do a few sessions of that, but no, if we target the right structure, that joint muscle stays like that, so you can exercise and progress, or and have better result. So then whether it's chicken or the egg, it's hard to know whether, say, if you have a stiff, if you're at a desk and your joints stiffen up, your muscles aren't pliable, and because you're just staying static at the desk, does that impact your nerves too? Because one structure can impact the whole region. So how do I tease that out before I get into the anatomy? Is you treat both. Alright, so at this point, let's go into the anatomy so you can see how complex it is and how it involves a lot of tissues. So it goes from your medulla oblongata, right? So that's the brainstem. It's very closely related to the other nerves. So vagus nerve is cranial nerve 10, so 9 and 11 also get impacted. So 11 impacts your traps and your sternocleidomastoid, so those are high tension muscles of your neck. So X is your jugular foramen, which is right. Okay, so jugular foramen is right. So if you go under your ear hole and you go down, you feel mastoid process. So this process right here, and then in front of it is the mandible. So right here, you can feel where the vagus nerve comes out. So from there, it travels down, and it kind of sits right in front of the sternocleidomastoid, and there's something called the cervical trigone. I don't know if I'm pronouncing it correctly, but that nerve, the vagus nerve, splits into superior, inferior laryngeal nerve, so it impacts muscles like the superior constrictor, pharyngeal constrictor, but it impacts the nerve to help you swallow, to help you stabilize your jaw, and so it goes towards that, and then it dives down, so there's an inferior branch of that, and then it dives down in, and then it reoccurs and reconvene around here. So Now that's so important to know because this is a high traffic area and it reconvened. So that's the vagus nerve. So this is a common spot that a lot of people have degeneration or wear and tear or stiffness pattern in the spine. So like going back to the rule, is it the nervous system and this important junction, or is it the spine? You have to address both. You have to do both. You have to keep it more supple, and then you have to strengthen it. Okay, and then so going back, a lot of people have headache, migraines, and tension in the suboccipital region, in the jaw region, and that's where a lot of the cranial nerve comes out of. So again, chicken or the egg, is it the nervous system that's impacting the joints, protecting it, or is it just sitting at a desk now causing the nerve to not move well, causing that dysfunction there? So again, so here's a high pressure congestion area, the throat, because that's where it branches out to a lot of the muscles and the structures of the digestive system, the respiratory system, and then right here where the nerve recurs. Because it goes into the pharynx, then it also impacts your ability to make the vocal cords, so your speaking ability. It connects to soft palate, so it helps with suction, and if you don't have good suction, then it can, food can go up to your nose. So as it goes down, right around your clavicle, your collarbone, is where there's a lot of tissue, important tissue like vascular system, like your arteries, your veins, and a lot of nerves just branch around here. And this is, so the nerve, the vagus nerve, comes right around here, and then so there's a left and right. So we're going to split now. We're going to talk about the right. So now as it goes to down, so your heart is here, and then you have big arteries or veins, or aorta, superior vena cava, and your lungs. So sandwiched between all that is your vagus nerve, and it sits right in between. If I actually show it to you, should have been more prepared, but you'll see. So the heart's here, the superior vena cava is here. It branches up like this, and it splits here and goes down to your body to supply your whole body with vascularity. It's really sandwiched right in between, and then it dives back towards the trachea and stays near the esophagus. So that's around rib 2-3, and the back is like T3-4-ish region. And in my experience, and a lot of manual therapists, physical therapists can voucher, that's a stiff spot for a lot of people. So before, I would work on that a lot, having to do multiple treatments of that, getting people to do exercise of that, and for a majority, that does work, but for some, it doesn't. And so you gotta ask why. So once I address that, I notice things just move a lot easier, less resistance, effort on everyone's part by addressing the vagus nerve along that pathway. Because the rule again, this is heart system, lung system, nervous system. So those are very high priority in terms of the hierarchy of tissues. And so your muscle and skeletal system will stiffen up to protect that. And so, emotionally, this is where we hold dear, we want to protect. Okay? So that's a side tangent. So it goes really, dives back towards the esophagus, which is really in front of the spine here. So it dives in, and then it goes right in front of the spine, thoracic spine, and then it splits, part of it splits into the cardiac plexus. And so it's a bundle of nerves that just surrounds the heart. So you can see how important that is. And then it dives down and it splits and impacts the liver, less momentum. So part of like kind of the right GI, and then the dorsal vagal trunk, so the back of the stomach. Alright, so then on the left side, it's a kind of similar path. It goes down, so especially near the collarbone junction, and then it goes to where the heart and the branches come out, and it dives back behind the trachea, the bronchioles. All right, and then it dives down towards now supplying more of the other part of your gut, so your pancreas, your spleen, and front of the stomach. So all that impacts, and you can see how from here there's a lot of tissue to want to protect. Okay, so hopefully I was able to explain to you in context of any tension that you might have and why no matter what you do it stays like that, or you constantly have to exercise and it stays stiff, like you go to a chiropractor and they manipulate over and over and over for 8-10 sessions, and yeah, it feels better, but there's always something missing. Or you go to a therapist or a hands-on a manual therapist, and you just can't, there's something missing. Okay, so that's because it might be the vagus nerve. All right, so comment below, let me know what your thoughts are about this specific nerve, and yeah, so that's it. Check it out.